So the IBIS-1 trial is a primary prevention trial testing the effectiveness of the drug called tamoxifen against a placebo among women that are at increased risk of developing breast cancer because of their family history. What we've shown is that around 66% of women are persisting with the medication for the full course of therapy, and that there's an association between women who experience headaches as well as nausea and vomiting and whether or not they continue with their medication. But interestingly, these effects are similar between both the placebo and tamoxifen arms of the trial, suggesting that women may be attributing naturally occurring symptoms to the treatment that they're currently taking, and this is affecting their behaviour in terms of whether or not they persist with the medication. Tamoxifen is associated, as demonstrated within the IBIS trial and several others, that women who take tamoxifen have a decreased risk of breast cancer, and this reduces the risk of breast cancer by at least 30% among women that are at increased risk. The IBIS-1 trial specifically showed that this effect of reduction in breast cancer incidence persists for at least 20 years after women have initiated the therapy. Yeah, so research in the adjuvant setting, so not the primary prevention setting, has shown that if you communicate the risks, the likelihood of experiencing a symptom with a medication before women take it, they're less likely to attribute naturally occurring symptoms to that particular medication. So we would recommend that we do a better job of communicating the risks of the medication, as well as establishing exactly the proportion of side effects that are actually attributed to tamoxifen and that aren't just actually naturally occurring symptoms.